Hello, today I'm going to be talking to you about arthrology. Arthrology is the study of joints. You may have heard of some words such as arthritis or arthroscopic surgery. Arthritis is a very common disorder where inflammation of the joints affects a lot of the elderly, and it's simply pain and swelling caused by inflammation of the joints. So what we're going to do is learn a little bit about the different types of joints and how they function. Okay. All right. Now, it's easy to think about a joint. You think about your elbow, you think about that's a joint. It's an obvious one. But we're going to learn that a joint is where two or more bones join together, where they meet. Sometimes we say that they articulate. You'll hear me say articulations, and that's just where bones meet together, and sometimes they move. So the technical definition of a joint is where two bones come together. Now, as you're going to see, it's not always as clear-cut and simple as a nice elbow joint. When we look at that, it's pretty easy to see that two or more bones are coming together and they're moving. Okay, so that's easy to see that that's a joint. But we're also going to find that you have some bones that don't move at all. So we base them on function, or how much movement there is between the bones. So our first name that you've got to learn is the synarthrosis. Syn means together, and it means that the joints are immovable. Some that you might automatically think about would be sutures in the skull. That's where two bones join together and they're not moving. Now, an amphiarthrosis is a slightly movable joint, and a diarthrosis, these are the joints that most people think about. These are things like your elbows and your knees and your fingers. These are the freely movable joints. And we can also label or describe our joints based on how they're put together. Again, a joint is where bones come together. So we're going to classify them according to how they connect. So the first kind is a fibrous joint, and these are connected by tiny little connective tissue fibers. The second kind is where joints are joined or separated by cartilage. And then the last kind are the synovial joints. And that's a word you just have to learn. It doesn't really sound like what it is, but these bones are separated by a space with fluid. And so the fluid allows them to move easier. It's like oil in your car. It's just going to give it a little bit more movement. And the synovial joints are the most common. That's what the majority of our joints in the body are synovial. All right, so first let's talk about the fibrous joints. There are three subdivisions of this. We have first a syndesmosis. Now, if you look at this picture here, we're told in our book that a syndesmosis is a joint. Two bones are coming together held by a ligament. Now, if we go back and we think about what a ligament is, we know that a ligament is a structure that holds bone to bone. A tendon is muscle to bone, but a ligament are fibers that hold bone to bone. And we know from histology that these are fibers of dense, regular connective tissue. So here we see the lower leg bones, the fibula and the tibia, and you can see that right here in this connection is a ligament. So the joint, the connection between these two bones in this particular area would be a syndesmosis. And we see here, I've labeled it amphiarthrotic, meaning slight movement. Just a little bit of movement is allowed here. Now I've included this picture here. These are also the same bones. This is the tibia and this is the fibula. They are also connected by a syndesmosis in between the bones that runs the entire length. And you can see these are oblique fibers. They run at an oblique angle. And this gives the bones a little bit more strength, helps hold them together, allows a slight movement. Okay. The next type of fibrous joint is our suture. We've been learning about the bones in the skull. So by now you should know that this is the parietal bone. This is the frontal bone, and back here is your occipital bone. Now, one way when you're looking at a picture of a skull this way is to remember that toward the front or the anterior it's going to be a little bit narrower or smaller, whereas in the posterior part of the skull is almost a little bit flatter and it's wider from this dimension in this direction. So that's the way to focus on the sutures to help you identify them. Because it's easy to think, okay, these are the parietal bones. The suture that's running straight down the middle, that would be the parietal suture. Now, it would be nice if this was the frontal suture, but it's not. It's called the coronal suture because it's running in a coronal plane. Okay? And I tell students that it's like a headband that some girls wear. It runs in a coronal plane right across their head. So that suture would be the coronal suture. Now, back here is this very back one that separates the occipital bone from the parietal bones. That suture is the lambdoid suture. So, we know a little bit about our sutures. If you look at them, you can tell that it's a squiggly line. It's not a straight line where the bones come together. And if you were to take and magnify that actual joint, the joining of the two bones, you would see tiny little connective tissue fibers. So that is a fibrous joint. And we say that it is synarthrotic because there's no movement. Now, the last type of fibrous joint is a gomphosis. And this is the joint that is between a tooth, or the root of the tooth, and the bone that surrounds it, either in the maxilla or the mandible. Now, you can see here in this picture, here's our bone down in this area. And if you look closely, right in here is the outer edge of the root, and right attaching it are these oblique fibers that run from the surface of the root to the bone, which is out here. So it acts as a sling or kind of a hammock to keep this tooth in position. And those tiny connective tissue fibers make up the joint or the gomphosis. Okay. All right, our next type of joint is based on whether or not cartilage is present. Now, we remember there's three types of cartilage. You have elastic, hyaline, and fibrocartilage. So we're going to find that two types of cartilage are present in these. And the first one I want to talk about is the symphysis. We have fibrocartilage, which you can remember from your three types of cartilage. Fibrocartilage is the toughest. It's going to have the most resistance to pressure, resistance to tension. So one of the places that we want to find it is where we need a lot of resistance, and that would be in our spine. Let's take the whole entire weight of the body and also allow some movement. Now, sometimes it's a little hard to think of your spine as having joints in it, but it does. A joint is where two bones are in contact with each other, so we have a bone here and a bone here, but they're separated by cartilage, in this case fibrocartilage. So we call that a symphysis type joint. Now, if you look up here, you may have already learned the term pubic symphysis. That's the joining or the joint between two parts of the hips. So if you go back and you think about our types of bones within the hip, we know that there are three bones early on that fuse together to form the hip bone. So up here we're going to have the ilium. Remember our spelling, it's always with an I, two I's rather. Back here, this bone is the ischium, and then this bone here is the pubic bone. So each pubic bone is going to join together and form a joint called the pubic symphysis. And again, we have that toughest kind of cartilage there, which is going to allow some movement. We have said that this symphysis is amphiarthrotic, so a little bit of movement. That's easy to see in the spine. We know that we've got to be able to rotate back and forth and side to side. A little bit of movement is allowed in the hips. Now, much more movement is allowed during pregnancy. As a woman's pregnancy progresses, hormones are going to actually soften this cartilage to a degree that's going to allow the hips to open and flare just a little bit more during childbirth. The second type of cartilaginous joint is the synchondrosis. Syn, of course, meaning with or together, and chondro, that's our root word for cartilage. Now, these are hyaline cartilage. Remember, hyaline's not quite as strong or tough cartilage. We're going to find it in some unique places. We're going to find it in every bone that has a growth plate. That growth plate, if you remember how bone is formed, you found out that a layer of cartilage is put down first and replaced by bone. So that is our growth plate or epiphyseal plate, and it's hyaline cartilage. So technically it's a joint. It's between this, which is the epiphysis, the very end of the bone, And here, this would be the diaphysis, or the shaft of the bone. So where they come together, there's going to be a synchondrosis. And notice that it is synarthritic. We don't want any movement here. We don't want part of the bone to move. Now, another place that you're going to find a synchondrosis is between the manubrium of the sternum and the very first rib, only the first rib. Now, if you remember the parts of your sternum, the very top part of the sternum was the manubrium, then we had the body, and then you had your little tiny xiphoid process that on the very bottom. So here, the synchondrosis type joint is with the very first rib. Now, the other ribs do have cartilage attaching them from the sternum to the rib, but these are actually considered synovial joints because they need to allow movement when we breathe. Now, on to synovial joints. These are, of course, the most freely moving type joints. These are the ones that we think of. Knees, arms, fingers. And again, freely movable, that term diarthrotic, meaning movement in all planes or movements. So most of the bones are synovial. You're going to see the ends of the bone are covered with hyaline cartilage right here, but they're separated by a space or a cavity. And in this cavity is going to be synovial fluid. And that synovial fluid is going to act as a lubricant to allow a greater range of motion. Okay. Now remember, the membranes that are enclosing this are going entirely around the joint. On this picture here, you're seeing a cross section, but you have to imagine that this is enclosing the entire joint all the way around. Now we have 6 types of these, and I'll start with the hinge joint. Now a hinge joint, if you take, this is an arm with a hand on it. If you take this, it's pretty easy to see that this is exactly what your elbow is going to be doing. It's going to open and close. Now, hinge joints only work in one direction. And I put this picture up here like this. That's a hinge joint that you would see on a cabinet or a door. And we know that hinges allow you to open the door and close the door. But that's it. They only work in one direction. Well, these joints, that's what they do. They only work in one direction. Now, I know you may not have gone over the terms flexion and extension, but flexion simply means that we bring 2 bones closer together. Extension means we bring them further apart or extend them. So that's a hinge joint will allow you to do that. And if you look at this, I've got a picture up here of the elbow joint. The humerus, which is your upper arm bone, is rounded or convex. And this part of the ulna is concave. So these bones are going to fit together like that and allow them to make this movement. And some common places, of course, are the knee, the elbow, and also the ends of your fingers. You have, if you look at the ends of your fingers, you're going to see that there's hinge action. They just go, they bend and they straighten. And that's all they do. Okay. Now, a plane joint, these are very simple joints. Again, a joint's just where 2 bones are coming together. So you have these bones. This is a picture of a foot. So these are tarsals. Remember the group name for all these small kind of squarish bones here. All of those are going to move slightly when you put pressure on your foot. Not a lot of movement, but they are going to be able to move back and forth different planes. So we say that's a gliding joint or a plane joint. Okay. Oh, and one more thing. You can find those plane joints in the carpals as well as the tarsals. All right, now our next type of synovial joint is the pivot joint. And this type of joint works around an axis. One bone is rotating around another bone. So, if you've been studying your bones in the vertebrae, you know that atlas and the axis are very unique vertebrae. And they are set up to allow our skull to do certain movements. You notice the dens, if you remember that's a particular part of the axis. It is a bony knob-like projection that sticks up and fits in between. It's going to stick up right in through here, and that's going to be the axis. Literally, that's, of course, the name of the second one, but it's going to act as an axis so that the other bone can rotate around it. And, of course, as you can see here with this picture, here, it allows us to rotate our head and say no. And of course, if you've already been studying about these, you know that the atlas is going to articulate with the skull, the occipital condyles, and it's going to allow you to say yes. That would be a different joint. Okay? And again, when I say bones articulate, I mean that they meet each other and they move together. Okay? Now, another good example of a pivot is your forearm. Now here, you see how the radius is being connected here to the ulna by a ligament. And that's a joint, okay? Be a pivot joint. Now, if you look back at my little bone here, and we said that right here, that was a hinge joint. Well, all of that is taking place with the humerus and the ulna only. The radius doesn't do anything as far as that hinge action. It's just along for the ride. So if you get the bones out and you pay attention, take a close look at them in the lab, and you'll see that the head of the radius is sitting there. It really doesn't do much for the hinge joint. All of that is taking place with the ulna. But what you can look at is what the radius is doing. This is the radius here. If you focus in on the head of the radius, as it rotates and turns around, it brings your hand over. Okay? It's going to cross these bones, form an X between the bones, and allow you to bring the palm of your hand and flip it over. We call this movement pronation. We pronate the palm. We take it from palm forward, and we cross the radius over the ulna, and we create the act of pronation. And that's thanks to the radius. And we say that that is a pivot joint. This would be the head of the radius. And you can see the movement is to turn it side to side. And then this would be, of course, this ligament that they're referring to. So again, you have a rotation around an axis. The head of the radius would be the axis. Okay? Another type of synovial joint is the condyloid joint. Now, this one is going to allow all of your angular movements, where you can make basically circular movements. And if you look at this diagram here, it looks like kind of like a mortar and pestle. You have one bone that is shaped rounded or convex. You have another bone that's more cup-shaped or concave. They're going to fit together, and they're going to go in more directions than the hinge joint did. Okay? So they're going to allow you to make hinge movements, but also side-to-side or circular motions. And the perfect example is the metacarpal phalangeal joint. Now this picture here, these are the metacarpals, and starting here are the phalanges. The phalanges, of course, being the bones of the fingers. Okay. Now if you look at your fingers, and you think the phalanges, there are 3 per finger, so these are the phalanges. The joint that I'm talking about is here, between the proximal phalange and the metacarpals, which make up what most people think of as their hand. So here is our condyloid joint, and it's going to allow you to make a hinge movement, but you can also make circular movements with it too. Okay? So it gives us a fairly good range of movement. Now the next kind of synovial joint is a saddle joint, which allows even more movement than the condyloid. If you look at this diagram picture, it looks like a saddle. You've got basically a convex concave surface on each bone, so that they can come together and go forward, backwards, side to side, and make all angular movements, even more so than the condyloid. And the only place that we can really see this is on the base of the thumb, and it's going to allow us to create this movement called opposition. I can touch my thumb to each finger. There's very few living organisms can do this. Just the primates can oppose their thumb. And the ability to do this is based on this saddle joint. Now, if you're looking at these, remember that I'm where this joint is. It's not here. It's much further down. Remember that your thumb only has 2 phalanges. So if you count down the joints, you have the joint here and here. This is actually the metacarpal. It's not as long as the other metacarpals, but it's here. And it's the base of this metacarpal where the thumb's metacarpal meets the carpals that you have the saddle joint. And that's going to allow us to do a wide range of motions. And I've got this picture right here, this is reminding me to tell you that it allows you to twiddle your thumbs. Okay, so it's going to allow you to full range of motion with the thumbs. All right, my last type of synovial joint is the ball and socket, and the name pretty much tells you everything. It's a ball with a socket, and we only have two places in the body. We have this in the hip. Again, if you're learning the parts of the bone, you know that this is the head of the femur, and it's going to fit into the acetabulum of the hip bone, which is a large, rounded, cup-shaped structure in the hip. It's going to allow the most movement of all. Okay, it's going to allow very free range of movement, and the most, of course, would be in the shoulder. We can do much more. We can throw a softball. We can put our arms in every different position. And here we're going to have the head of the humerus. It's going to fit into the glenoid cavity. Sometimes it's called the glenoid fossa. But again, this is a diarthrotic joint that allows movement in almost every direction. Well, that's all I wanted to talk about joints. I hope you enjoyed it. Thank you very much.